Welcome, everyone. My name is Yasmina Sisarak. I'm the host of today's webinar. Healthy Webinar Series is presented by the HealthMatters program at the University of Illinois at Chicago in partnership with National Task Group on Intellectual Disabilities and Dementia Practices. We are funded by the Centers for Disease Control and Prevention through the Healthy Brain Initiative. Contents are solely the responsibility of the presenters and do not represent the official views of the CDC. Couple of housekeeping items. Continuing education credits are not offered for the webinars. Each live webinar will be recorded and available to view on YouTube with resources to download or view online. An email will be sent to you once the content becomes available. We will have a 10 to 15 minute question and answer at the end of the presentation. So please use chat box for comments and questions, and we'll save them for the later. Today, I wanted to introduce Dr. Jane Tobias. She will be presenting on Beyond Access and Inclusion, Belonging in Healthcare for the Population with Intellectual and Developmental Disability. This project aimed to create an intellectual and developmental disability-friendly healthcare initiative in an academic medical center to address healthcare gaps. 5 educational curriculums were developed, multiple educational programs were delivered, standardized patient simulations were implemented for graduate nursing students, and the Diversity, Equity, and Inclusion program has been initiated. Dr. Jane Tobias will be presenting on her experiences today. A little bit about Dr. Tobias. Is an assistant professor at the Jefferson College of Nursing, Thomas Jefferson University. She currently serves on the National Association of Pediatric Nurse Practitioners Executive Board as an at-large member, where she's able to continue to advocate for children and their families and support the advancement of pediatric nurse practitioners in their careers. Welcome, Jane, and take it away.
Thank you, Yasmina, for that introduction, and also just thank you for the invitation to be able to present here today. As Yasmina said, my presentation is not hard science, it's not a lot of data, but what it is, it's my story of my fellowship and the project that I worked on for the past year in that fellowship. As we move through the presentation, you will see the path that I followed, the reasons why I chose the project that I chose. And what I'm hoping that you can take away from it are just some strategies, maybe some inspiration, maybe something that we did will speak to you about how you can change the way you practice in your organization, perhaps start a program in your practice. And really, this was a labor of love for over a year. I did not do it alone. So as I move through my presentation, you will meet a lot of folks that helped me along the way and that played an integral role in creating this really practice change, this culture change in the health system for which I work. So we are going to get started. I have no disclosures and no conflict of interest. These are the objectives that I set forth when I decided to work on this project. And I would first just like to thank the Golisano Institute for Developmental and Disability Nursing for the fellowship opportunity. I was part of the inaugural class that went through last year, and we finished in June. And since then, I have been gifted with tools and strategies through that fellowship that enabled me to continue my work over the past 6 months and to keep moving forward with this project. So what I really wanted to do when I set forth was to look at the health institution in which I worked. We're unique in that we're an academic medical center. So I work full-time on the university side in the College of Nursing, as Jasmine has stated. And then we also have the adult medical side, the medical center, which I will share a little more about that with you. But I wanted to align the priorities of individuals with IDD and their families and caregivers with the mission and the vision of that healthcare setting in which I worked. I also realized, as we all do, that there's just a gap of knowledge among providers, among patient-facing staff regarding care for persons with intellectual and developmental disability, as well as our students, both in nursing programs and medical programs. And lastly, and I think probably this was really what kept me motivated in moving forward, was creating that healthcare environment of inclusion and, more importantly, of belonging, of making that patient feel like they belong in our healthcare setting and that they don't have to fight any more barriers, they don't have to fight any more challenges in accessing their healthcare and their healthcare resources. So, what is the why of my project? And I think this is really going to give you a good foundation as to why I chose the project and the different strategies that I implemented along the way. First and foremost, you have to have that passion for what you do. And for me, my passion started back in 1986 as a new graduate nurse in the infant intensive care unit at the Children's Hospital of Philadelphia. That's where I worked for 13 years before I moved on and received my certification as a pediatric nurse practitioner. And it was in that environment, working with premature infants, working with full-term infants that were born with various genetic anomalies or conditions, that I saw how hard they fought and their parents fought for their life, right? To get them out of that ICU and to make them productive citizens and have them move forward in our world. So that was my passion starting in the NICU. I then went into primary care practice, and it was there that I got to really see the hardships that these children and adolescents face as they try and transition to the adult care world. We all know that there's not a lot of adult care providers that want to take an adolescent with an intellectual disability or with complex medical needs. My doctoral work focused on transitional care for that population. And then lastly, when I arrived at Jefferson with my pediatric background, which really pediatrics has that environment set up for families and for children to be able to access a lot of services. But when you go over to the adult side, sometimes there's a bridge that's missing to get those services and get those resources. And that's what I saw working in an adult program, working on an adult side of healthcare. Secondly, our perceptions. That was a big part of my why. Many of us are familiar with Lisa Iazoni's work, particularly the article that was published in 2021 that looked at physician perceptions. And we found out that 82% of physicians reported that they perceived people with significant disabilities having a worse quality of life. And I think more importantly, only 40% were confident that they could provide the same quality of care to a patient with a disability. As a pediatric nurse practitioner, as a healthcare provider, I have to believe that those numbers just aren't unique to the physician population. But yet there's an opportunity, a big opportunity to come in and to change those perceptions. And then lastly, the 200 million individuals worldwide that do have an intellectual and or developmental disability. And in the United States, we estimate there's 7.5 million adults and children with intellectual and developmental disability. So this really was my why for wanting to jump into this project and to try and change, create, shift a culture in an academic medical setting. To do that, I knew there needed to be a paradigm shift among all levels of providers and patient-facing staff, as well as on the university side and the education side. I also realized that my team would have to become influencers. We haven't made it to the TikTok platform yet, but yet we had that power to start influencing others, to have them jump on the bandwagon with us and also be our champions in changing the culture. So who are we? And just to tell you a little bit about the background, where I'm working, where I come from, Jefferson Health System is comprised of 18 hospitals and rehabilitation centers that are primarily located in the Philadelphia area. We go into the suburbs of Philadelphia as well as over the bridge into New Jersey. We have approximately 13,000 providers, nurses, and nurse practitioners employed by Jefferson Health. and we have 5 million patient interactions annually. So we have a huge opportunity to impact a lot of people in a positive manner. On the university side, we're a medical and a health professionals university with about 8,500 students. We have several campuses in the Philadelphia area and also several international campuses. The woman that is pictured on this screen here is Dr. Mary Stevens. Dr. Mary Stevens is director of our continuing care program, which is a program that sees adolescents starting at age 14 across the lifespan who have an intellectual or developmental disability, who have complex medical conditions. I met Mary in 2018 when I was doing my doctoral work, and she just came to Jefferson with this vision for her continuing care program. We both shared that passion, and she's the one that came to me about 2 years ago and said, listen, are you interested in applying for this fellowship through the Golisano Institute? So it was Dr. Mary Stevens and Dr. Wendy Ross, the director of our Jefferson Center for Autism and Neurodiversity, that recommended me for the fellowship and have really been my champions and my mentors in moving our initiatives forward. Again, this is just a short little introduction into what each of these important centers at Jefferson Health do. Again, Dr. Ross is at the Center for Autism and Neurodiversity, which is both programmatic and a clinical practice. And that has really been helpful in moving a lot of our initiatives forward, having that programmatic piece. And Dr. Mary Stevens, who runs our continuing care program, who really is there to support our patients and their families. And then obviously the university setting, the academic side, which is where I'm able to have somewhat of an impact in our various programs and bringing more education to our nursing students, to our medical students, our occupational therapy students. So this is just a quick diagram of what it is that we do in trying to create this culture shift. This was what I used in the different programs that I wanted to set forth at Thomas Jefferson University and in Jefferson Health. So we were operating through a health system as well as a university. So we had two areas we had to focus on for the process in which we were going to initiate. And that process, first and foremost, involved an interdisciplinary team. And that was key in my success in having a lot of these initiatives move forward. It just couldn't be a single discipline. So we have Dr. Ross, who's a developmental pediatrician, myself, who is a pediatric nurse practitioner. And if you think about it, here you have two pediatric focuses in a big adult academic medical health center. And I think that was really important because we worked from the model of a medical home. Family-centered care was really pediatric bound about 20 years ago when I was working down at CHOP. And then we also have occupational therapists, art therapists. Our students have been immense champions for us, our medical students, our occupational therapy students, and nursing students as well. We look at the population, obviously, in which we're working with, folks with intellectual and developmental disability. It is so important in everything that we do that we have focus groups and we get their perspective and ask what is important to them. How do they see this working? If we come up with an idea, we present it and let them tell us, this is great, but have you thought about this? Or this isn't going to work, or it doesn't make sense to me. So having that perspective in anything we do is really, really important. Education. I've talked about it already, and we both know, all of us on this presentation today, that there is a large amount of education missing from academic programs for our nursing students in caring for the IDD population, our medical students as well, our occupational therapy students. So being able to develop programs of education that could be utilized by faculty in different areas was a priority for me, and it still continues to be a priority. I have found that sometimes working on the hospital side, the healthcare side, is a little easier and the return is a little quicker than trying to bust down some curriculums on the university side. But we're still trying and we are making progress. Outcomes, so important for anybody that's out there interested in a quality improvement process or doing something that involves change. You have to look at those outcomes and they have to be measurable. So everything that I chose to do along the way, I worked with a researcher that works within the Center for Autism and Neurodiversity, and we developed outcome measures. Those measures eventually help drive policy, they help drive change. We're able to show our track record through those outcomes and get more buy-in as we continue along our journey in creating this culture shift. We are looking at learning along the way. What have we learned from our experiences? What do we need to change moving forward? And I think lastly, and sometimes this gets forgotten when you're working on a project, the environment in which you're working. And I'm not just talking about your environment. For me, it would be Jefferson Health and the university, but the environment of those with intellectual and developmental disability, that built environment. What's that room like they're receiving their care in? What is that waiting room like that they have to sit and wait in? What is the sensory input like in that room? Is there something you could do differently that would make it a more positive patient experience for them? Right now, one of the great projects that we're working on is creating waiting room chairs that are sensory friendly. And this has really been an exciting project because we're using our own advisory board, which is made up of individuals with IDD and family members. We're actually doing focus groups and bringing these groups into a setting and having them try out chairs, not just for the fit, but for the feel, for the fabrics we're using, the ability to get in and out. Does it make them feel safe? So it's always important that whatever you're working on, consider that environment in which you're going to do the change, because I guarantee you there's something there that you can make an impact on and change for the better. Now, this is kind of a busy slide, and it speaks to my year with my fellowship at the Golisano Institute. And we were introduced to Cotter's change model as a foundation to work on our projects. Many of you may already be familiar with Cotter's change model, but this was the approach that helped guide me in my work in that project space. So first and foremost, it was important that there was a sense of urgency in what I was doing, and that needed not to be created as much because COVID was already occurring around us at that time. One of the pieces of work for which I did as part of a team that I was really just quite proud of and was also a great motivator in moving this project forward was we wrote an article that looked at the impact of COVID on the IDD population. And we surveyed, probably 64 million charts. We did a chart review at 574 institutions. And we found that having intellectual disability was the #1 risk factor for getting COVID. Those numbers were staggering, and that if you had an intellectual disability, you were 30% more likely to die, but also less likely to be admitted to the ICU. So what that was telling us is there's a huge communication gap. There's a huge accessibility gap to getting that healthcare that is needed. And again, my fellowship was right around the time that COVID was at its peak. You were unable to get vaccines. So this was really an urgency as well in creating the project. Secondly, who was my coalition? I had to find my people. I had to find my allies within my healthcare setting, within my university. I had 2 allies, Dr. Ross and Dr. Stevens, that I've already mentioned, but we had to dig a little deeper. We had to start making partners, those people that bought our passion, that recognize the urgency. Then creating that vision and strategy. And I talked a little bit about that in my objectives at the beginning of the presentation. We know in the IDD world, there's so much that still needs to be accomplished. There's so many gaps and voids that need to be filled with research and with folks like us that can make a difference. that I found myself at times going down rabbit holes, just starting to go in the wrong direction because there was a greater need here or another need here. So having that vision and having that strategy is what grounded me. And it's what kept me moving forward in my project goals rather than getting stopped at a rabbit hole and going down that. Next, we all know about connection. We all know about the importance of communication. And what I say, it's action over words. We can have meetings all day, but if we don't have any action items, if we don't have anything that comes out of those meetings that is tangible, that I can say to my stakeholders, to my allies, look, we made a change here. These are the outcomes for the change. It's really going to be hard to continue to progress down this change model and to get buy-in along the way and to gather those allies and those champions that are going to keep that momentum moving forward for you. Next, I had to look at the barriers in my health system. And there was a lot of barriers. It was occurring my project at a time, again, during COVID, where these smaller projects like mine weren't always the priority. They weren't always high on the agenda. And rightly so. We were battling burnout from our nurses and our physicians. We were having families that had yet to be able to accompany their loved one who had IDD into the hospital. And that was something we changed right away, that visiting policy that they must be allowed to have a member with them. Looking at short-term goals, or as I say, going for that lower hanging fruit. What is something that you can change quickly that won't take a whole lot of allyship to work with you in changing? And that will help you develop your track record, right? So what you want to do is identify that smaller project that you can accomplish maybe a little more quickly or without a lot of barriers. And then you add it to your portfolio, and now you're starting to develop a track record of change within your institution. Next, you have to build on that change, right? You want to increase your footprint. You want to increase your reach within your setting. And for me at Jefferson Health and at the university, we started by educating just small groups of people about intellectual disability, about neurodiversity, how to communicate more clearly. What are some supports that we can put in place? How can we change the environment? We were having education sessions with the security staff. We're an inner city hospital that has a large homeless population surrounding it. And it was important that security had some education, had some knowledge, and also had us as allies in that setting that could work with them. We then went on to the oncology floor and did more education there. We went into primary care practices. We went to the nursing students. So again, we slowly started to build on our change. People began to recognize us and reach out to us as well. And then lastly, and this is what we're still working on, and I think this is something that everybody who is trying to make a change understands, making that change stick, making it sustainable. And I say sustainable, and I say it in big, bold letters, because if you create something that has multiple steps that only you understand or a small team of you understand, it won't be sustainable. And that was a real challenge for me. And looking at everything I wanted to accomplish and saying to myself, how can I do this and do it in a way that somebody else could replicate? Or if all of a sudden I wasn't here the next day, they could pick up the process and move forward. So sustainability, making it stick, is super important in any endeavor you set out to do. And this is just our project process down and dirty, looking at that population, looking at our allies, both internal and external. Our community in Philadelphia is a big source of allyship for us. And when I talk about some of the projects in which I worked on and we helped to move forward, you're going to see that external allies, external supporters are just as important as those internal supporters. And it really is about finding that champion. And it can just be one champion, and that's all you need to start spreading the word. And then being really clear in the goals that you set forth. And for me, as I said in the beginning, this was about equity. This was about inclusion. This was about belonging and access, most importantly. So having those goals always in your forefront. For me, I have them on my screensaver. I have them taped at my desk, and that roots me. That gives me my foundation for what I want to go back to. When we're working on something, I ask myself, is it achieving inclusion? Is it achieving belonging? And is it achieving healthcare access for this population? So these are some of the goals in which we achieved. Again, myself and the team that I work with, this is always a collaboration and an interdisciplinary effort. I broke it down into 4 buckets. I looked at education, I looked at community, the built environment, and our academic curriculum. So for an education standpoint, as I said, we just went around doing something similar to this, 45-minute presentations with a Q&A for 15 minutes. And we spoke to physical rehabilitation, we spoke to palliative care folks, integrative medicine, GI, oncology, the nursing department, human resources. There's so many folks out there who have a neurodiversity but can't make it past human resources to get the job because of the interview process. It's not built and designed to support them. So we wanted to let our HR team at Jefferson know some changes they could make. There's great candidates out there and they're loyal employees. Why can't we get them through the front door? Our security team, our DEI, our Diversity, Equity, and Inclusion program at Jefferson. This has been ongoing work for us, our DEI program. They have had us multiple times to come and speak, but they focus primarily on race, gender, and culture and not disability. That drives us crazy, but we keep knocking at their door and saying, hey, we have a new presentation. Can you give us, a 12-to-1 brown bag slot? And we keep persisting. What has been rewarding for us with all the education that we have done around our healthcare system and our university system is getting feedback from employees, getting feedback from faculty and students that will email us and say, thank you for this education, thank you for making inroads. I have a son, I have a nephew, or I was just recently diagnosed myself with autism as a female who's in her 40s, and now I feel a little more supported in the environment in which I'm working. Next, we looked at our community partners. If anyone knows Philadelphia, you know that we are exuberant sports fans in this city, and we reached out to our sports allies, the Phillies, the Flyers, the Eagles, the Sixers, the Philadelphia Union. We had a wonderful program going this summer with the Philadelphia Phillies, and that they gifted us tickets to multiple games throughout the summer in an accessible section for our families that have young adults that have children with intellectual and developmental disabilities. We were then able to partner with the medical school students and nursing students to come to the games and support these families and patients, or families and their children and their adolescents, so they could just have a normal family experience on a summer night at a ball game. It also helped that our Phillies were really successful the latter part of the season, and no, we couldn't get World Series tickets for our families, but it was really just a fun summer to come and enjoy and learn from these families and what they go through. We also have a horticultural program with a local news station in the Philadelphia area where we grew a garden all summer, and we were interviewed a couple times a month with our folks from various programs that worked with us that have intellectual disability. And at the end of the summer, we had a segment, Farm to Table, where they actually prepared several different types of appetizers from the fruits of their effort, and also donated a lot of these vegetables to Philabundance, a food charity in Philadelphia. I think one of our neatest projects, and something that has occurred after I left the fellowship, but again, a lot of the tools that I learned there helped us, was our relationship with the Pennsylvania Supreme Court. and working with them primarily in the foster care courts, and making the court system user-friendly for children and for their families that are coming into it that may be on the autism spectrum, that may have an intellectual disability, and educating the attorneys, the judges, just the folks that work in the court, looking at the courtroom, again, thinking of that built environment. How can we make this more user-friendly, less sensory offensive? So that was a really neat project that we worked on as well. I talked a little bit about the built environment in the chair project, but something else that I was part of that was just really an interdisciplinary effort was a program we did with our immersive art department at our university with Lynn Godley, who has a long track record of immersive art using lighting in the art experience. And what we did is we looked at waiting rooms, and we all have sat in waiting rooms for hours and hours, right? You go for an appointment at 11, you're not brought back until an hour later at 12 because your physician was delayed for one reason or another. Well, for somebody that has an intellectual disability or has a neurodiversity, sitting in that waiting room, getting exposed to all that external sensory stimulation can really be overwhelming, that by the time you get back to the exam room, they're done, they've had it, and the visit does not go well. So how can we change that? And using lighting, and again, asking our advisory board, asking those specifically with IDD what they wanted in a waiting room experience helped inform some of the changes that could be made. And this team used lighting and used different sensory input experiences to create a better experience in that waiting room. And then lastly is the academic side. This was more of a comfort area for me, being an educator in a graduate program of nurse practitioners. But what could we do to start educating our future, right? Our future nurses, our future physicians, our future fashion design folks that are designing clothing. So first and foremost, one of the first projects I worked on was creating standardized patients, and Dr. Ross and I put a lot of blood, sweat, and tears into developing 2 standardized patient scenarios that involved young adults on the autism spectrum. One was nonverbal and one was verbal, and we used those standardized patients to educate nurse practitioner students both in our adult gerontology, both primary and acute care programs, as well as our pediatric nurse practitioner program. We received a lot of positive feedback from the students being able to work in a safe space and learn how to have effective means of communication during the interview process, learning how to do a physical assessment in a way in which the patient was comfortable, that the touch was done correctly, the questions were asked in a manner in which the patient understood. And then the feedback we received from the standardized patient actors being able to participate in an education process like this was really overwhelming and not something we expected in our outcomes when we did our surveys at the end. But they really appreciated that we were looking at the neurodiverse population in creating standardized patient scenarios. Not a lot of schools have done that yet, and that they were really excited to be part of that as well. We developed a fashion course. As I said, part of our university has a textile program, a fashion program. Dr. Ross and I this summer in our humanities program ran a course for medical students called Beyond Disability, Storytelling Outside the Lines, where we had 15 medical students for about 8 weeks. And we did a weekly, I'm not even going to say it was a course because really it was more just bringing in all different types of folks to share stories with our medical students about the disability community. We started off by watching the movie Crip Camp, which is how we started our fellowship to kind of set the foundation for learning about advocacy and policy in this setting. And it was a huge success. our medical students were so grateful for the opportunity. As they said, they don't get a lot of education in their curriculum regarding caring for an individual with an intellectual or developmental disability, and actually being able to hear lived experiences from folks with IDD, being able to visit places of employment in the Philadelphia area. We have the Get Cafe, which employs only individuals with IDD, and also we have the Get Ready House, which is a house where a young adult with IDD can go and stay for 2 weeks and learn how to live with a roommate, live independently, grocery shop, prepare meals, learn a budget, and do all of those things. And being able to bring medical students to these places to say, when you're working with a patient, this is where they're being discharged home to, that they are gainfully employed, and you need to get them back to that level. What type of care and resources can you provide when working with that patient and getting them on the road to wellness as well? We do a lot of work, as I said, in our design space with our immersive art designers as well as with our architects. We do a symposium every year with our College of Architect and Built Environment. It's an international symposium that runs 1 to 2 days and has been very, very successful. And I think perhaps our most recent program, which I'm really excited about and that Dr. Ross and our team has worked very hard at, is our cybersecurity program at Thomas Jefferson. And what's really unique about this is that we have a partner in a university near to us, St. Joe's University, that has a program called the Kinney Program and Kinney Scholars. And we have a lot of students that are on the autism spectrum and are interested in the area of cybersecurity. Well, Jefferson has a need for employees that have expertise in cybersecurity. We realized after talking with the director there that there's a huge opportunity. So we're partnering with him and with St. Joe's University to start bringing some students on board for internships and learning a skill set, and then hopefully turning around upon graduation and having employment. So that is really exciting as well for us. And again, these are just some of the projects I have been involved in that were part of my fellowship that we moved forward. And one that I want to point out that we've done for several years now and is really neat, and I think also specific to our Philadelphia area, but certainly could be replicated in any major city, is our Philadelphia Flowers Show, where we work with the Horticultural Society as well as Subaru, and we're able to bring individuals, their families, their loved ones who have IDD, who have neurodiversity, into the flower show before the gates open for the thousands of people that come, and just have a wonderful experience in exploring the different senses and sensory environments it is outside for us in Philadelphia. And that's really been very successful as well. I talked about inclusion and belonging really being the foundation of the work I do, and this is just some pictures of our team here. We did at a local car dealership, a Subaru dealership, we went in and said, listen, can we educate your staff about working with individuals with autism, neurodiversity, and IDD? They have to buy cars, their families have to buy cars, and if you can create an experience that is low stress, low anxiety, just by learning a few different strategies, that would be awesome. Subaru was a terrific partner. They opened their doors. We went in on a Friday night. We did an education session prior to that, and it worked really well for us. You see a picture of us with the Supreme Court, and then there at the bottom is our team of gardeners that worked with us in our summer garden this summer. This is the COVID vaccine clinic that we started that came out of the article in the New England Journal of Medicine Catalyst that I spoke about earlier, that talked about intellectual disability being the #1 factor in getting COVID. So we were able, when the vaccine first came out, to get it through Jefferson Health. and created a vaccine clinic just for individuals that had IDD, that had a neurodiversity, that had autism, where they could come in a safe space, take all the time they needed with their families, and get vaccinated. So we were able to vaccinate, lost count of the number of people, as well as their family members. And we were flexible. Dr. Ross and I were out in the parking lot because we knew a lot of our patients just leaving their car was highly stressful. So we would go out into the parking lot in March with our coats on, deliver the vaccine, and then sit out there for the 15, 20 minutes after the vaccine with the families. And they left feeling like at least their adolescent, their young adult, their child was protected against the COVID at that time. This is just a depiction of our specialty care pavilion, the Honickman Specialty Care Pavilion, and it was constructed by a young man, Campbell Smith. I don't know if anybody is familiar with the Autisarian Network. I have it listed there on the slide. Google it. Campbell Smith is a young adult with autism who has an incredible gift of creating replicas of different things. He's done stadiums and coliseums, and this is our new specialty care pavilion that is being erected at Thomas Jefferson Health that is neurodiverse friendly, that is being designed to create, again, a sense of belonging and inclusion, and also more equitable healthcare access for patients with IDD, for patients with autism and neurodiversity. This is some of the work we did in shifting that culture and driving policy through the Special Olympics. And again, CNN covered our COVID vaccine center, which was quite exciting at the time. This was the article that was in the New England Journal of Medicine Catalyst that I spoke about regarding the impact of COVID on individuals with intellectual disability in the United States. And it was through this work that we were able to really start pushing policy change. Because of that work, the COVID-19 landing page on the Center for Disease Control actually put a link in about people with intellectual and developmental disabilities and how they should be prioritized in getting the vaccine at that time. So in conclusion, I have a few minutes left before I can start taking questions, if anybody has any questions for me about some of the lessons learned in creating this project. And I have a little saying here. This is our woman with her hair on fire, and she often guides our work. And I have to say, this came from Dr. Ross, and it is about really not letting anything get in the way. So if you read through it, you can see that at times flying was impossible, walking to the moon was impossible. Someone will always try to say it's impossible until it gets done. So who cares if it's impossible? Let's do it anyway. And that really is our mantra. Our other mantra is run until apprehended. So with a lot of these projects, we would just keep moving forward. We would just keep pushing forward until somebody actually said, you have to stop. And I have to tell you, we haven't heard that yet. So that is really encouraging that the culture is shifting at Jefferson Health. But first and foremost, lessons learned, it takes a village. Nobody can do this alone. As I said, you have to find those supporters, both internal and external. You need a champion, and sometimes champions come out of the least likely places. For me, several of my colleagues in the College of Nursing initially came to support me when I started doing these educational sessions and presentations, I think just for moral support. And then they started hearing me and learning some things, and that was wonderful because they started seeing their own students and where some changes and different strategies could be utilized in making our students more successful, our students that have neurodiversity. The 3 Ps, as I call them: persistence, patience, and passion. If you don't have the 3 Ps when you set out to do a change project or to implement something, it's going to be that much harder. And then that interdisciplinary team is such a huge factor in what I do at the Center for Autism and Neurodiversity. It brings really different perspectives to the table, and you need to have folks from all over giving input into the work that you're doing. Some of the limitations and challenges I found along the way, you heard me say it multiple times, COVID-19, that did us all in. And what happened is the burnout that we saw both in our staff, our medical staff, our nursing staff, our patient-facing staff, as well as our faculty and our students. And not only do we need to support them with the burnout, but we also had to kind of take a step back and say, people can't put any more on their plate right now. I'm going to take a pause in the education that I'm doing and just let things settle out a bit. So really learning from your audience, reading your audience. Are they ready for that change? Are they ready to hear more from you? The size of our organization. As I said, we're an academic medical center. We're quite large, but don't let that intimidate you. Start small. For us, we started with our security team, where we had, I think, 10 people in the room, and that was one of our first presentations. Then we just kept going and going, and then we realized our room was starting to grow. And then for everybody, I don't think I have to say this, funding. It would be wonderful if we could all win the lottery, but funding is so important in moving your projects forward, getting those grants. And that's where the outcomes, measuring your outcomes is so important, because that will give you the data that you can use to drive some of your funding and to apply for some of those grants. What were the surprises? Well, the emergence of supporters and champions from least likely spaces. And by that, I mean, we have a nurse manager on the oncology floor in our Center City Hospital that is a huge champion of ours, that depending on what is going on, will call us and say, I have somebody with trisomy coming in that was just recently diagnosed with leukemia. Would you be able to help our nursing staff with some different strategies for this patient so they can have a positive experience and their family can? We noticed that we started to increase the membership on the advisory board within our Center for Autism and Neurodiversity, which was exciting. That we had increased engagement from our focus groups, and that our focus groups were getting bigger and we were getting more input, which is really helpful in the work that we're doing. That feedback from employees is wonderful, and also increased employment opportunities for students and for the IDD community. And then lastly, diversity is being invited to the party, inclusion is being asked to dance, and belonging is dancing like no one's watching. And we want all of our folks with IDD, with neurodiversity, with autism to feel like they are dancing and no one is watching when they come to our center for their care. And just some acknowledgments, as I said, the Golisano Institute of Intellectual and Developmental Nursing faculty, Shirley McMillian, who was my mentor for the year of my fellowship, who was just extraordinary and was able to retire during that year. So I hope that she is doing well up in Canada. The Golisano Foundation, the IDD community themselves, and my partners at Jefferson Center for Autism and Neurodiversity and the Jefferson Continuing Care Program. So again, I thank you for your time and just for listening to me share my experience over the past year.
Thank you, Jane. This is Yasmina again. Please feel free to put any questions that you have in the chat box. In the meantime, what are the next steps for Jefferson Center for Autism?
Yes, thank you, Yasmina. So the next steps for us, to give you the abridged version, we just actually had our end of the year meeting yesterday where Dr. Ross talked about her vision for 2023. But a project that is really near and dear to our hearts, which is moving forward, and Dr. Sarah Ailey had a huge part in for us, was the development of a health resume for those 5 million patients that come through Jefferson every year, and being able to create a document where people can put their abilities and their preferences for their care, for communication, what would support them best, was so important to us. So we are almost nearing the finish line for that, and I would say that is our next big accomplishment we hope to see in early 2023.
Thank you. Can you speak a little bit more about the health resume? I think some
Yes.
of our attendees may be interested in that.
Yeah, so the health resume again came out of the work that Dr. Ailey and maybe even Dr. Marks, who might have been part of that resume as well, originally did. And coming from a pediatric background, I was very familiar with the amount of information that goes into our electronic medical records regarding care for pediatric patients with IDD with complex health conditions. There's an abundance of information, and providers get to know their patients very well, their likes, their dislikes, if they need an injection, how to prepare them for that ahead of time, or if they do better in a dimmed room to be able to accommodate that. But I found on the adult side, you just don't have that yet, and we need it desperately. So again, through several champions and allies that we found along the way in our work at Jefferson Health that had experiences with people they know and love that had intellectual disability or other complex health conditions, the health resume we felt was an important tool to implement and to get started. So using focus groups of individuals with IDD, our own experiences as providers, we started creating that document. And again, it's a document that has data that can be a checkbox and it can also be a fill in the blank. It's already been embedded into our electronic medical record, as well as our version of my chart, which I think a lot of big hospital institutions have. So hopefully when somebody does the check-in for their visit, it pops right up for them to complete, and then it automatically will get embedded into our Epic system. So we are piloting this hopefully in the new year, and we're piloting it in an oncology setting, a pre-op setting, a primary care setting, and a pediatric practice.
That's very exciting. So hopefully you can come back and do
Yes.
another webinar, a follow-up webinar on the health resume.
Yes.
There's a question about what were those statistics of number of people with intellectual disability who died of COVID versus the ones who were admitted to ICU?
I will be honest, I don't have the numbers off the top of my head. However, I can share the article with you that does have that data in it, because there is a lot of statistics and data woven through that article in the New England Journal of Medicine, the Catalyst. So Yasmina, if I can send you the link for that, possibly we can have it provided to our participants.
Yes, we can actually include the link with our YouTube recording for sure.
Wonderful, thank you. And thank you for the question, Patricia.
Another questions, can you speak more about how people with intellectual disability informed your project?
Yes. So some of the projects that we worked on, specifically our standardized patient projects, the health resume, we did a lot of visual stories, particularly around the COVID time of COVID and thereafter, regarding getting injections or when they have COVID testing done, things that are important to them, our Phillies games as well. And we did focus groups over Zoom. We didn't do them in person, and just, asking what is important to you? What do you want us to know? Like, for example, when having your COVID vaccine done, it was important, which we didn't consider initially, that some folks said, the bright lights bother me when I go to the doctor. So in our vaccine center, we had sunglasses they could put on. We had headphones to cut down on the noise that they could wear as well. We had some sensory friendly chairs that they could sit in while getting their vaccines. So again, it was more of, what is important to you? What do you want us to know that would be helpful for X, Y, and Z, for whatever project we were working on? The fashion course, which we hope to be implementing next year, we already have some participants from our advisory panel that will actually be interviewed by the students regarding when they wear clothing, what bothers them, what feels good. We think of the basics, labels and snaps, but it's more about fabric, it's more about texture, the fit of something. So again, that is how we would use our folks on our advisory panel and in our community settings to help us with the work that we do.
Another question, in retrospect, are there any processes that you would omit?
Um, no, no, I wouldn't admit anything. And I will tell you why, because at some point, and it may not be in the succession in which we saw with Cotter's model of change, but at some point, each of those stages did play a role in anything that I was working on and developing. So I would say I wouldn't omit anything. I will tell you when I was, implementing certain things and looking at different projects to consider and do, I would not necessarily do them in succession, those different steps, but they were always addressed at some point. So no, I wouldn't omit anything.
Thank you. I was able to find the article, so I put the link to in the chat box. But we will also make it available on our YouTube channel as well. The
Thank you so
impact of
much.
COVID. Yes. Please let me know if there are any other questions for Dr. Tobias. I wanted to take another opportunity to thank you so much for this wonderful and informative presentation. Please, I'll be in touch with you and keeping up with the health resume, because that is something that I think our audience would find super informative and interesting as well.
Absolutely.
Thank you. Thank you all who attended today. I know it's close to the holidays. Happy holidays. This is the last webinar of our season, and hopefully see you all in the winter in January. Thank you all. Thank you, Jane.
Thank you, and happy holidays, everybody.
Same to you. Bye.